Hello everyone, and welcome to the Cardiology podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this episode, we'll be diving into the exciting advancements made in 2023, focusing on novel therapies that were uncovered in the ways we prevent and manage cardiovascular disease, CVD. Lodoco, a new hope for ASCVD prevention. In June 2023, the U.S. Food and Drug Administration, FDA, approved Lodoco, which is the brand name for colchicine 0.5 mg oral once daily, a first-of-its-kind anti-inflammatory drug for reducing cardiovascular events in people with established atherosclerotic cardiovascular disease, ASCVD, or those at risk of developing it. This was a breakthrough, offering a new weapon in the fight against heart disease. Bempedoic acid, statin alternative for high-risk patients. Another promising development was the CLEAR Outcomes trial, which solidified the role of bempedoic acid, brand name Nexletol, in lowering cardiovascular risks for patients who can't tolerate statins. This drug provides a much-needed alternative for those who previously had limited options. Semaglutide, the GLP-1 superstar. Semaglutide, brand name Wegovy, emerged as a new cardiology buzzword in 2023. This GLP-1 receptor agonist shone in multiple trials, including the SELECT study, which demonstrated its effectiveness in reducing cardiovascular events in overweight or obese individuals with pre-existing CVD, even without diabetes. Recaticimab, a long-acting PCSK9 inhibitor. The investigational PCSK9 inhibitor Recaticimab made waves at the American Heart Association (AHA) scientific sessions. In the REMAIN-2 trial, it more than halved LDL cholesterol levels compared to placebo, with a convenient dosing schedule of once every 3 months. This could potentially improve patient compliance and adherence to treatment. The power of zero coronary artery calcium, CAC, versus LDL cholesterol. New data from the multi-ethnic study of atherosclerosis, MESA, strengthened the concept of the power of zero when it comes to coronary artery calcium, CAC. The study suggests that for individuals with zero CAC, elevated LDL cholesterol may not be a cause for concern or treatment. However, for those with established atherosclerosis, lowering LDL remains a priority. LODESTAR, treat to target versus high-intensity statins. The LODESTAR trial answered another important question about LDL cholesterol management. It found that a treat-to-target approach, using statins, was non-inferior to the guideline-recommended high-intensity strategy in lowering the risk of major adverse cardiovascular events, MACE. This adds valuable data to the ongoing debate about the best approach to cholesterol management. POT-HT, self-monitoring of blood pressure with remote guidance during pregnancy. The POT-HT trial studied the impact of self-monitoring and remote doctor consultations on blood pressure, BP, control in new mothers with high BP during pregnancy. The study found that these interventions led to significantly better BP control compared to usual care after 9 months. This suggests that empowering mothers with tools to manage their health and communicate easily with doctors can be highly beneficial for long-term cardiovascular health. In conclusion, 2023 was a year of significant advancements in the field of cardiovascular health. From novel drugs like Lodoco and Semaglutide to innovative approaches like treat-to-target and remote monitoring, the focus is shifting toward prevention and personalized medicine. Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.